Hello, my name is Laurelle and I'm a patient at Mediclinic City Hospital. My journey began a couple of months ago, where in 2019 I underwent a routine colonoscopy on the 28th of July. Originally, the months prior to that, I thought that I just had irritable bowel syndrome, suffering with issues of constipation, then diarrhea, abdominal pain, a lot of lower back pain. But this progressively got worse. And then I started feeling a deep pain within my rectum. I also noticed that when I went to the bathroom, unfortunately I started having rectal bleeding, and this became a concern. So the routine colonoscopy at Mediclinic was to investigate. Unfortunately, I was diagnosed with colorectal cancer. When I was diagnosed with colorectal cancer, it had already metastasized to a stage 3 cancer. The tumor itself was a T3 tumor, ranging between the size of 6 to 8 centimeters based on the tests that I had undergone. The doctors had then decided that because of the size of the tumor, that I would have to undergo surgery, obviously also chemotherapy and radiation. So my journey began with a Mediclinic City Hospital, where I started with radiation first, a high-intensity radiation for a short period of time, namely to reduce the bleeding of the tumor. Once this was complete, I underwent with Dr. Shahina a round of chemotherapy. During this chemotherapy session, I also consulted with the surgeons. My surgeons were both Dr. Zakir Mohammed and Dr. Roger Gurji. When consulting with the surgeons, whilst going through my treatment, they thought that the best possible route would be robotic surgery. At first, this was very unfamiliar for me. However, they explained to me the benefits of doing robotic surgery, especially in my situation with regards to the size of my tumor and the positioning of the tumor within my rectum. That the robotic surgery, not only in my situation, would provide precision of cutting the tumor in the rectum to the point where I would not have to have a colostomy bag for the rest of my life, but also to ensure that they safeguard the safe tissue in the area where the cancer was. The robotic surgery also does benefit you, as it is four small incisions, round about 1 centimeter each, instead of having this large gash running across your abdomen. The good news for me, there was limited bleeding. Post-recovery was much faster. Right now, I'm able to walk, I'm able to eat, I'm able to exercise. To be honest with you, I'm feeling absolutely great.